Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Today is Super Mama Sunday and we are talking cold and flu symptoms during pregnancy. What to do if you have them, what are some of the safe ways to treat them. So make sure you stay tuned for all the details. All right, girls. So almost inevitably, women during their pregnancy are going to have some sort of upper respiratory infection symptoms. So this could be sneezing, runny nose, stuffy nose, sinus infections can occur, cold viruses, flu viruses, the COVID virus. So it's so many things that can happen during pregnancy. And a lot of moms worry about what things are safe to take, what things are safe to do. So I just want to give you a few tips today on what to do if you are having upper respiratory infection symptoms and warning signs that you should be aware of, so that you can notify your doctor or go in and be seen and taken care of. So first, let's just kind of list out some of the symptoms that can occur. You can see here that, there are a lot of different symptoms. One of the things that I talk to mamas about is that there is dilated blood vessels in the sinuses during your pregnancy. And so some women will experience sinus pressure or sinus pain. They may have really runny noses, or they may have really stuffy noses. And so that is something that can happen just from pregnancy alone. But if you are having, you're producing mucus when you sneeze or blow your nose that is blood tinged or really thick, or if you're having like weird color mucus, like green or yellow or brown or slightly bloody, this can be a sign that you actually have a sinus infection. The same thing is true with coughing. If you are coughing up a mucus that is really thick, that has weird color to it, or that is blood tinged, this can be a sign that you may have a lung infection. So it's really important to notify your OB about that. If your mucus is nice and clear and kind of stringy, that's usually okay. And so definitely anything that's going on during your pregnancy is fair game for you to bring up with your OB care provider. But if you're just trying to ride this out at home, here are some safe ways to do so. The first thing is on my list is always hydration. Make sure that you're staying well hydrated, drinking water, Gatorade, Pedialyte, something that has electrolytes to keep your electrolytes in balance. Many times when pregnant women don't feel well, they've got cough or cold symptoms, they really may not have much of an appetite, so hydration is extra important. In addition, it is totally okay to drink hot lemon tea or hot lemon tea with honey or herbal teas. Those are fine to have. If you are experiencing sore throat, you can certainly do cough drops. Those are very safe to take. Also consider acetaminophen products or Tylenol products like Tylenol cold and flu are safe to take during pregnancy, just like you would take an extra strength Tylenol for pain during pregnancy. We really want to avoid aspirin and alcohol containing products. So, I always tell my moms, like, if you see these nighttime cold cough deals that are usually liquids, we want to try to avoid those. I really prefer that we try to avoid alcohol containing products. If you are looking for products to take that are safe, I've made a list of the things that I recommend for my patients here. I do really try to ask women to avoid the -D products. So this is like your Claritin D or Mucinex D. These contain pseudoephedrine. This is a medication that causes vasoconstriction, or it causes the vessels in your nasal passage in your sinuses to constrict. And it really helps to decongest you if you have a lot of nasal or sinus congestion. But in some women, it can really increase their blood pressure and their heart rate. So if you're going to use a decongestant product, you want to talk to your OB care provider first to make sure that you're not someone who already is at risk for high blood pressure or who has high blood pressure in pregnancy. So in terms of decongestants, it's totally okay to take regular Claritin, regular Tylenol cold and flu, Benadryl is okay. So these are some of the medicines that are safe to take during pregnancy. Zinc, vitamin C are also very helpful when you are feeling like a little under the weather. And certainly eating a very healthy, balanced diet is going to be important to keep your immune system healthy. Exercise is another great way to boost your immune system during cold and flu season. And of course, if you have not gotten your flu vaccine, I highly recommend that you do so. The flu in pregnancy can be dangerous. So we really encourage women to get the flu vaccine if they're okay with that during their pregnancy. So in terms of warning signs, things that you should be calling your OB care provider about or coming in to be seen for are certainly if you have fever or chills. And a fever is a temperature greater than 100.4. So if you have temp greater than 100.4, you should be contacting your OB care provider or coming in to your local labor and delivery unit to be seen there or in the ER, depending on how far along you are. Also, if you are coughing up very thick or colored mucus, you should contact your OB care provider. And certainly if you are coughing or sneezing and producing blood-tinged mucus, that's usually a sign of infection or a sign that your nasal passages, sinuses, or lungs have gotten so irritated that there's now some bleeding that's going on. So if there are concerns that you have, make sure you share them with your OB care provider. If you're just trying to ride this out at home, some of the medications I mentioned before are completely safe to take in pregnancy. Obviously, we really like to try to have a natural route. So zinc, vitamin C, and healthy diet is a great way to keep your immune system healthy. So I hope that this video was helpful for you. Give it a thumbs up if it was. Make sure that you subscribe so that you don't miss a single Delivering Joy MD TV episode. Hit that notification bell so you can see when I upload every Wednesday and Sunday. And I'll see you soon, girl gang.